It's one of those necessity is the mother of invention type of questions. Obviously, we'd much prefer to see our patients face to face. Rheumatology is all about the history and physical exam. And it is a little bit more difficult to take a history on telehealth. Some of our patients are older and they don't even have computers. So, that really poses a lot of challenges. And of course, the physical exam is very difficult because we like to palpate joints and we like to look at the skin and we like to feel the skin. And it's just very, very difficult to do that by telehealth. On the other hand, this is hopefully a short-term solution. Once this is over, we'll get our patients back in and do, that kind of very thorough physical exam. But we do feel as though from a physical distancing standpoint and a safety standpoint, if we can manage to get a patient through a visit and to do the critical things that are needed at that visit by telehealth, it's probably safer for the patient in the long run not to have to come into the office. And we've talked a lot about this. Is this going to change the way we manage patients in the future? And I do think that if a patient is doing very well and can get their lab work locally and nothing is changing, we could certainly do some of these visits by telehealth. And I do think that we're going to be doing more of this. One place where I think it would be very, very helpful to use telehealth is that we have a concentration of rheumatologists. For example, where I am in Boston, in my neighborhood, there are 6 rheumatologists like within 3 blocks of me. Whereas in Wyoming, I think there are 2 in the entire state, pediatric and very few adult rheumatologists as well. So in that setting, we could really extend the reach of rheumatology by using telehealth. And I think this is teaching us to do it under a very stressful situation where we almost have to do it. And then I hope that what we've learned from this is going to be useful for the future in terms of our workforce shortage that we're looking at down the line.